Welcome to Speaking of Midwives, the official podcast of the Journal of Midwifery and Women's Health, where we bring the pages of the journal to life. I'm your host, Melissa Avery. Each episode, we go deep into the evidence, spotlighting the researchers, the breakthroughs, and the midwives leading the science that is transforming reproductive health care. Greetings and welcome to Speaking of Midwives with the Journal of Midwifery and Women's Health. Today, we are talking with Dr. Julie Blumenfeld, Associate Professor at Rutgers University School of Nursing. Welcome, Julie.
Thanks so much for having me, Melissa.
Well, the first thing I would like to ask you about today is a little bit about your midwifery background, just to kind of acquaint our listeners with you, because we're going to be talking about an interesting study that you did with some colleagues called Identifying Drivers and Barriers to Precepting Midwifery Students. A little part of me lives on in each student midwife, and I just know that a lot of us resonate with that.
Yeah, so I became a midwife in 1997, which right now actually seems like it couldn't even be true. And since that time, the majority of the time as a midwife, I've worked clinically, and the majority of that time I've worked in Trenton, New Jersey. I'm from New Jersey. I grew up here and love serving the community here in the state. And along with my clinical practice, I have done a lot of precepting midwifery students, and also educating and training residents, both family medicine residents, and now more recently, OBGYN residents. And also, along with my clinical practice, which I would recommend was for so many people, I've been really involved with community in Trenton. So I have partnered with lots of folks in Trenton involved in different aspects of perinatal health to develop some community programs for education and support for newly immigrated Spanish-speaking people in Trenton. And most recently helped develop a doula program. There's an outgrowth of some of that other work that I've done.
Yeah,
And
thank you.
in 2020, I moved to Rutgers. I started teaching at Rutgers. And for the past 5 years, I've been the program director of the midwifery program at Rutgers.
How many years did you say it's been?
It's my 5th year as program.
Wow. Given that you and I got to know each other around that time, it's hard to believe it's been that long.
Yes, I agree. Time is a funny thing.
It is. Well, I have really been looking forward to this conversation because the issue of qualified preceptors, as a former program director myself, is huge. And I think it's really one of the most important areas in midwifery as we look forward to growing our profession and our workforce and our ability to impact what's going on in maternity care in the United States. So would you just share a little bit with the listeners about what led you to your interest in conducting this particular study?
Yeah, I'll say that, as a practicing midwife, I really increasingly understood the demand for preceptors. Like I mentioned, I've precepted since I was a really early career midwife. And I recall distinctly being reached out to by midwifery programs in the area, in and around New Jersey, asking regularly to precept one student. Can you take another student? We have a student that needs to site last minute. Can you take this student at this time? And there came a time with the organization that I work for where we were suddenly disallowed from taking students, and all of us were upset about it and advocated. And it took several years. We never really even understood why, but it took several years to reinstate our ability to precept. And when I became program director, I understood this whole other dimension of precepting, because now I was responsible, faced with this challenge of securing sites for my students. And I recall a discussion with you when I very first became a program director, and you telling me about the challenges that you had faced at University of Minnesota and sort of some of your strategies. And I remember it really resonated with me. You were like, I started a year ahead for each site. And at the time I was like a year, and now I understand. I understand really fully. And I also know that that's not unique to Minnesota or Jersey. This is an issue across the nation. This challenge of securing sites and the right site for specific students. And around the same time that we had that conversation, the GAO, the Government Accountability Office, came out with a report about midwifery, about birth and workforce and midwifery education. And that report highlighted on this national level, in this official report, the struggle, not just about program directors, but also specifically highlighting the struggle the students have. So seeing it from even another dimension, that I as a student really didn't experience, that individually, but that I know now that students across the nation face this on a personal level, a challenge of finding sites. And so it really seemed like the challenges surrounding clinical education, not just this ask like midwives need to precept, was really underexplored and super important, an essential component to growing our workforce, increasing access to midwifery care, and really is very complex and also needed to be explored from different perspectives. At the time at Rutgers, we had gotten some funding from the Department of Health that we still have. So we've developed this great project, the New Jersey Midwifery Education Project, and a huge focus of it is supporting preceptors. We were having these in-person workshops for preceptors on a variety of different topics that are still ongoing. We're having another one on June 1st. But we had the opportunity to engage with preceptors, and it really made a sense to start there because they were there in person, interacting with us, interacting with each other. And we thought that we could ask them to share their thoughts and their perspectives. And it seemed a really low stakes, low pressure environment to engage with them on these issues.
That's great. Thank you for all that background. It's so helpful to understanding the issues that we're talking about today with your study. So given what you just said, leads us into the next question I wanted to ask you, which is, can you describe a little more precisely then, given all that, your specific aim or purpose in conducting this study? What exactly were you after?
Yeah, well, we were really interested in looking at preceptors' perceptives about their beliefs about the role they had in educating students, the future midwives, and highlighting both the opportunities that it offered to precept, so the good, and also the barriers, the challenges, the issues to precepting students. And we hope that it would provide insights for people about their thoughts and feelings about the role, and also possibly uncover some challenges and things to improve. And on a very sort of personal level for Rutgers and the work we were doing, we wanted to know what we could do locally with this information to best support the preceptors that we were engaging with on the day-to-day. We had this funding. What could we do with this funding that they wanted, that they needed, that we could support them, instead of making assumptions about these are the things that we think would be the best things for them. So I think it was really on this micro level here in New Jersey, and on this macro level, what do we have to offer out about this sort of universal experience for midwifery in the United States about precepting?
Right, right. That's great. So could you just share briefly a little bit about your decision to use the socio-ecological model to frame your study? I found that pretty interesting.
Right. So, as I mentioned, I really learned firsthand as a program director at Rutgers how incredibly complex clinical education and this piece can be. And I had experienced pushback, as I mentioned, on an individual level from administrators, from physician colleagues, even midwives themselves, who were like really willing to precept, who wanted to precept, and then they couldn't because of these other barriers. And I knew that on a personal level what that was like. And so we came to this project with our own ideas about these various levels, with decisions were being made about that were impacting precepting for our students, which really lends itself well to this model. And for those who don't know, this framework allows you to look at occurrences situated within both an individual level and then also this interpersonal level and institutional level. And so for clinical education, this means, preceptors inside themselves, their thoughts and feelings, preceptors with students, preceptors with their colleagues, and also then at the institutional level, at the hospital, at the state, and then potentially even at the level of policy and advocacy. What does that have to do with precepting and helping it happen or impeding it from happening?
Great. That's really helpful. What went into your decision about the active data collection method you used rather than, for example, doing an open-ended survey or maybe talking individually with people?
Yeah. Well, at these workshops, there was a lot of engagement. There was a lot of momentum. It was a really supportive collegial environment. And we as a profession asked a lot for preceptors. And so these workshops were an opportunity for us to give back and really nice meals for them and try to have fun swag for them. And besides the education, just creating this super collegial, warm environment. And they're sharing experiences and sharing thoughts and feelings. And it seemed like a really good opportunity to ask them to engage in this activity about their perspectives. And also this data collection strategy really allowed us to have a large number because, more than you would typically get in qualitative research, because there was a big group of people that were there for the workshops.
No, that makes sense. By the way, is the content from those courses or presentations you gave available to people beyond New Jersey?
Yeah, so the New Jersey Midwifery Education Project has a website. And on the site, there's a page dedicated solely to preceptors. There's an informational video, and there's a link to the site that we formed that's a preceptor learning platform. So we took lots of these workshops and we turned them into asynchronous learning opportunities. So there's videos and additional information with links. There's up to 8 CEs currently, and we're hoping to add a new one later this year. There is a nominal fee for it. It goes to the Midwifery Scholarship Fund for students at Rutgers University. And during National Midwifery Week, we discount it. So if folks are interested and the cost seems prohibitive, please circle back that week in October because you'll find it there for a very affordable rate.
Thank you. Thank you for that. I would like to switch now and talk a little bit more about the study and kind of how you did that. So would you say a little bit about the nuance within the themes for each of the specific questions you asked? So I'm kind of asking 3 questions in one, but I'd like to kind of talk a little bit about those 3 parts: the challenges, what's possible, and being worthwhile related to serving as a preceptor.
Yeah. And what we found when we asked the questions and we looked at the responses is that they we were able to categorize them in themes within each of these questions. So I can highlight some of the ones that were particularly impactful or that people really seemed to gravitate to. Their responses sort of fell into these buckets really naturally. And so in terms of what made precepting challenging, and I think this will really resonate with the midwives listening to the podcast, is time. And this idea of the kind of push and pull between wanting to give this great care to the people that we're serving and also wanting to spend time with the students. That's one aspect of this balancing. And then also the commitment of time or the schedule or having to keep up with the patients that you're seeing on the day-to-day and also not wanting to not be responsible about your obligation for teaching the student, and sort of how do you balance that sort of teaching and caring at the same time. In terms of what made precepting possible, what came up again and again was support. And that support was within the practice, like, is this a practice that's supportive in general of having students? And then the institution, which is a huge element of this. As I mentioned, I worked for an institution that all of a sudden sort of turned off the faucet and we didn't know why and said, you just can't do this anymore. And so is it possible institution wise? And then something that I don't know that we had necessarily thought of, but certainly makes sense, is support for the preceptors in terms of education. And I think, this isn't unique to midwifery. We see this across professions, but that you are an individual in a profession, and then you're expected to automatically also teach about that profession to other people. Teachers have all kinds of training in order to be teachers. We're clinical midwives or educators, in a classroom, and that's really different from translating those skills to teaching in a clinical setting. So preceptors were looking for some of this how-to, which is really what the workshops were focused on. We have these great skills. You might be someone who's just excellent at suturing, but doesn't mean that you can translate that into how do you teach someone how to suture in the best way in the clinical setting in the moment, or even like managing an emergency like a postpartum hemorrhage or shoulder dystocia. That's not being able to clinically manage that and even speak to a patient in a really compassionate and thorough way, patient-centered way during that is not the same as also teaching during that process. So how do you do that? And preceptors were looking for that kind of support. And then in terms of worthwhile, I mean, this is the part that just hopefully will resonate with everyone about, the joy of sharing midwifery, on that really interpersonal level with the student. We love our profession and we want to pass that on to others. And this idea of growing the midwifery pipeline, so growing the workforce, was another piece in that theme that came up in what that makes worthwhile. And then, and that's really where that a little part of me lives on in every student came from. And then I can speak a little bit more about that, but also this piece of personal development that, it really, it keeps you current with your skills. It helps you learn new things when you're continuing to teach. And just to circle back to that, growing the midwifery pipeline, to me, that really stood out. And again, that quote that is in the title, a little part of me lives on in each student midwife. I think about that often. And I think it kind of goes both ways. So yes, there are midwives out there practicing that will circle back to me and say, I remember this moment, or I so appreciate your support that you offered, or even just relate a story about another preceptor and how meaningful it was to them to have that support. And I think it's really a two-way street. I think about things that I've not even just current clinical skills, but just the joy that students have brought me, and how that experience of teaching them is still in me. I was at the Midwifery Policy Summit on Monday, and I was sitting with a midwife who is now in her 10th year of practice, and I was her preceptor. And
Oh, wow.
can't remember, I was reading something she had written, and it said something about me being her mentor. It's like, I'm not your mentor. And she's like, of course you're my mentor. And I was thinking, it's funny because she has influenced me and how I see the world and how I think about things. We've become friends and we're good colleagues. And I think as much as she sees me as her mentor, I see her as having changed things in my practice and my worldview. So I think it goes both ways.
Absolutely. Absolutely. Um, there was another quote that stood out for me. It went like this: never had time to do it at its best. That just resonated so much for me. Um, it's so telling, I think, in what we do as preceptors. So how do we work within those systems to be able to both help midwives feel like they can take really good care of their patients, but also help bring the next generation of midwives along, or
Yeah.
medical students or residents or whatever it happens to be?
Time is tricky. And we heard this again and again from participants. Participants themselves had suggestions about helping with time, things like having really clear objectives from educational programs about what students need to learn, so they're able to really focus on the things that are really needed. Um, and sharing students across a practice so that one midwife isn't the same person precepting again and again. And, also midwives described hoping for some kind of workload reduction, which I think can be really tricky. Time is also money. And so that piece of it becomes really hard. And I think about, I had this really interesting conversation with a relatively early career midwife who's fabulous, who's teaching students at Rutgers, who reached out to me to say that how much she enjoyed precepting and how much she loved having our students, and that she just couldn't keep up, and she wasn't sure was she was going to being able to keep doing it. And she reached out to me to ask if I had any suggestions, which I thought was lovely, instead of just saying no, because she really did like doing it. She was just feeling really overwhelmed. And so I just started by asking her, like, what does a typical day look like for you? And what does it look like for the student? Remind me about how many patients you're expected to see. And it was mostly sexual and reproductive health care. And she said, well, in a given day, I have 30 patients on my panel, and it's just hard to go in and out with the student for all the patients. And oh my gosh, it's not the expectation. And I know that we had this conversation up front, but I think that she hadn't done a lot of precepting. And I think in the mix of the conversation about so many different sort of logistical things and suggestions and her excitement and my talking about administrative things, that this piece got lost. And we have a great preceptor handbook that specifically talks about, strategies and these kinds of things, from the university that we've developed specifically for midwifery preceptors. And I said, let's go back and look at this together. And, do you have time to meet and talk more about it? And we talked about strategies for, not having the students see every single patient, and that they can go in, they can review charts, they can do note writing while you're in with patients, and they're seeing every several patient, and the expectation would never for them to be. And she's like, oh my gosh. And, she went back and has precepted now for several semesters, thinking in sort of these different out of the box ways and that strategy. And it's just gone so much better for her. And it makes me realize that, I think sometimes when you're in the thick of it, you don't realize or even think to ask these questions. And we need to be always circling back, particularly people that are early in their career. But I think everyone who's precepting and, talk about strategies to make it more feasible and different things that other people have discovered of ways to make it rewarding and manageable for everyone, so that people not only just want to keep doing it, but that it's logistically possible. Because, to think that a student would see ever that many patients in a day, never would be our expectation. It isn't realistic.
Right. That is a very full day, to say the least. Well, can you say, this actually fits really nicely with another theme that resonated with me. Can you talk a little bit more about recharge for seasoned midwives? Because it kind of fits with that, though she was newer.
Yeah. So I think, a lot of midwives that were attending these workshops were people that were well into their careers. And I think that they talked quite a bit about this, how precepting helps them feel this sort of renewed sense of energy about the work that they're doing, and that it helps remind them about why they got into this in the first place and their sort of internal motivation. But it can be really inspiring in the midst of the day-to-day struggles to get the excitement of a student that's just entering into this and really, really enthusiastic and learning all these new things and so excited to be exploring all the new things they're learning, actualizing them in the clinical setting. And that they felt like that excitement was really contagious, and they liked getting that up-to-date information from the students in the day-to-day.
Right. I remember hearing that a lot from people. What would be your main overall message to our colleagues about this topic of precepting, both for people who have been precepting for a while, but also those that may be considering becoming a preceptor to midwifery students?
Right. So hopefully this will make you smile, because I feel like these are the kinds of things you and I talked about when I was first transitioning into becoming a program director. And, I asked you for suggestions about, like, what should I read? What should I really be focused on? What are the things? And, you always would circle back to the core competencies. And, there's a core competency that clearly outlines our professional responsibilities. And one of them is precepting, that this is part of supporting our profession's growth. And so I think just to remind people that part of the heart of midwifery, right, is, our professional responsibility. And a big part of that is growing the new generation of midwives. And, that precepting is that, right? We are growing our profession. And so, by precepting students and demonstrating, how they can actualize the things that they're learning in the classroom, in the clinical setting, and teaching them that vast wealth of knowledge we have as experienced midwives is really important and really needs to be taken seriously. And it's how we're going to continue to grow our profession, and expanding access to midwifery care. So super important. And also, I will add that we know that the overarching structure for how we are engaging in this entity of precepting really needs to be modernized, and so that we're not dependent on a series of personal favors from people. And that's really what the current system is, and that it could be more effective. And we want to make sure that it's not causing harm, to midwives in practice, to students that are searching for preceptors or matched with someone that's really not a good fit. So we have work to do.
We definitely do. And you already mentioned the policy conference that just was held by the American College of Nurse Midwives. And so interestingly, a number of us have just been talking about this very issue and going to talk with our legislators about the lack of a good, sustainable system to educate midwives, where the similar thing exists for within the nursing profession and within the medical profession. And it doesn't really exist for midwifery. And we do need to do some work, don't we?
Yeah.
So on that, what message or what implications do you see for individual health systems within which we do this work?
Right. So we can't grow midwifery without having support from health systems. This is essential. And so we really need to work on, I think, in part, how we talk about midwifery and framing midwifery as the gold standard for care for people without risk factors throughout their lifespan, focusing on birth, certainly, but care for people throughout the lifespan. And I think that's probably part of the message, right? That we do more than attend births, which, sometimes is the narrative about midwives. But I think, highlighting that the care we give is cost effective, that we have amazing health outcomes, there's increased patient satisfaction, all the talking points we know about midwifery that we use when we talk to legislators. But why midwives really should be caring for the majority of people, who have low risk pregnancies, just like they do across the globe in other countries, right?
And then beyond that, what broader implications related to policy do you see to get a system that will work better for educating midwives?
Yeah, so I think a piece of that is money. So reallocation of funding or development of new funding at the federal level, so that there's funds to support midwifery education, much like the funds that support our physician colleagues through graduate medical education. And we know there's funding at pending legislation at the federal level that would do just this, Midwives for Moms. But I think that's a piece of it. And then just like I said, sort of re-envisioning this big re-envisioning of clinical education that's inexorably, part of our education system. And so in some ways, making it that way within education programs. And there's been some really innovative models, particularly in new education programs that are doing this. And also we know that, it's easy to say that, sure, reimagine how we are structuring precepting. It's not without challenges and certain funding, but I think that that's a piece of this. We have done this the same way for a really long time. And really, we need to think about how to restructure it across programs in a way that's different.
What else do we need to understand about this whole system of how we work with preceptors in midwifery, specifically related to research? What else do we need to know or ask?
Yeah. So after we did this project, as you know, we moved on and we did a series of qualitative interviews. We started here in New Jersey, and we didn't just interview midwives. We interviewed hospital administrators, folks that are in education here in the state, to try and get a diverse sample of people that are involved in one way or another at different levels with precepting, to understand a little bit better. And then we wanted to get more the perspective of students. And so we rolled out a study that we called SIMPLE, which stood for Strategies to Improve Midwifery Preceptorship and Learning Experiences, to explore nationally the perspective of students. So we interviewed early career midwives, realizing that they were really close to the experience that they had as students, and asked them pretty robust list of questions in a survey about their experiences as students and then their experience as early career midwives, to see how their experience being precepted influenced their early career years as midwives, including whether or not they're precepting and their thoughts about precepting, and how when they were precepted and their experiences influenced their desire or capacity to precept in those first few years of practice. And I think one unanticipated finding of that study was the experience of sexual and gender minority midwifery students, who in this research really fared more poorly as students in terms of their overall experience. And so I think addressing those inequities is super important to building a more diverse midwifery workforce, and also broader efforts to advance general perinatal health equity. So certainly that's something that I think needs to be explored more fully.
Thank you. That sounds very important to continue to follow up on. How would you sum up kind of your main message to our colleagues after this longer discussion?
Yeah, I think when we look at in the day with our colleagues and within institutions, thinking about how what is the lens we want to see all of this through. And so thinking about this sort of as at the macro level, what are the things that really can move the needle where we are in the precepting situation, like things like public policy, because that's certainly an area that needs growth. And I should circle back and say that when we looked at this socio-ecological model and we looked at the answers that the midwives gave in terms of where were the challenges and where were the opportunities, fully missing was the area of policy. And so
That's
this
right.
is an opportunity to engage midwives about government advocacy and what can be done on that level to change this situation. As I mentioned, the Midwives for Moms legislation is one way this needle can really move, and how many people even know about that or engaged or involved about that. And so I think about really thinking about things like on the day to day, it's important, within your institution. I think, I talked about even like when new midwives are graduating and they're making contracts with hospital systems, think about, am I allowed to precept midwifery students? Because if I'm not, I want that changed in my contract. We think about contract negotiation, all the things we talk about. Like, I don't know that that's something front of mind with people, but you wouldn't want to get into a job and automatically assume you're going to be able to precept midwifery students. Not a thing. So on that micro level, but on the macro level, government policy and how that needs to be changed so that we can, so that we're able to precept. Hope that answers the question. I feel like maybe I went a little bit of it.
No, I think that's exactly what
Yeah.
what needs to happen. I mean, there's so many levels, as you've said, to this problem, and we need to get active at that higher level of government action in order to be able to have similar kinds of support for health professions education as we see among, our nursing and medicine, colleagues and others.
Yeah. Yeah.
So, if you could sort of distill everything down into a sentence, can you do that and just share something inspirational for people on this so important topic of
Well, I think
precepting?
that part of it is just the recognition that I wouldn't want anyone to think that I don't understand, both on this very personal level of day to day, walking over the threshold, entering a room with a patient and knowing that the other patient is waiting and that the day is really busy and you want to give full attention to that patient. And also you're being asked to precept. So yes, I understand the challenge. And also, without precepting, we won't have midwifery, we won't have a profession. And so um, there's something to be gained for everyone. The students gain, the profession gains. There's so much that we see individually that can be gained from it. And I think that so worth considering precepting always, even if in this exact moment, for whatever reason, it doesn't work, think about how in the future it could. And then I think for students out there, I would say, we want to support you. We want to help you. We want to know about the challenges you're having so that we can help try and fix them. And also, when you're thinking about the job you're going into and the position you're going to have, again, like lots of things matter in that negotiation, but being able to support midwifery as a profession by precepting is an essential part, knowing that you're going to be able to do that in your job. So I guess for, program directors and professors that are, bringing up students and talking to them about job possibilities and workforce pipeline to think about, precepting as a piece of that, an essential piece of that, and as students to make sure that they're able to do that in a position that they take. And just knowing that, we picked this title with tremendous intention because I think it's meaningful and it really resonated, but there's truth to it that, this is such a piece of what we do, and it's a way to pass things on. But I think of, midwifery is really relational, and caring and teaching midwifery is just another dimension of that, right? Of that sharing, of that, warmth, interpersonal interaction that we have with patients. We have that with students also. Yeah.
Thank you. And thank you again, Dr. Blumenfeld, for joining us today, and to our listeners for joining us on Speaking of Midwives. Please come back and join us the next time.
Thanks so much for having me, Melissa.
It's been a pleasure. Thank you for joining us on Speaking of Midwives, brought to you by the American College of Nurse Midwives and the Journal of Midwifery and Women's Health. If you were inspired by today's conversation, connect with us through ACNM's channels. The Journal of Midwifery and Women's Health is at jmwh.org, your resource for cutting-edge midwifery and women's health research. See you next time.